Meet Pharmex, the Mexican subsidiary of Global Pharma, a multinational pharmaceutical company. Under the group structure, Pharmex is categorized as a limited risk distributor, meaning its business purpose is to distribute Global Pharma's products and services in Mexico. But what does that mean exactly? And more importantly, are the real functions carried out by Pharmex consistent with an LRD categorization? Today, we're going to break down one of the most common and most dangerous fictions in transfer pricing: the phantom limited risk distributor. According to the intercompany agreement, Pharmex acts as a simple distributor. They don't set commercial strategy, they don't control investment decisions, they don't assume market, inventory, or credit risk. They are limited to following orders from Global Pharma's HQ. The result? Pharmex obtains limited profit for its simple distribution activities. Let's say 5% operating margin. Simple, clean, defendable. The remaining profit, that goes to Global Pharma abroad, because they supposedly bear all the real risk and own all the valuable intangibles. But the reality shows. But let's look at what Pharmex actually does. They built a distribution network covering over 2,000 pharmacies and 150 hospitals across Mexico. They manage relationships with government medical institutions, research institutions, and major private hospital chains. They negotiate prices and discounts with institutional buyers. They handle inventory risk, including temperature-controlled storage for biologics worth millions. They employ over 200 people, including sales teams, regulatory affairs, and logistics specialists. And, what is typical in the pharmaceutical industry, they execute local marketing campaigns and promote pharmaceutical products with physicians and medical professionals, organizing large events to position brands in specialized markets and a complex regulatory environment. Does this sound like a limited risk operation to you? Here's where it becomes expensive. When Mexican tax authorities audit Pharmex, they don't accept the contract label. They look at the actual functions. And their conclusion? This is not a limited risk distributor, and it shouldn't be compensated like one. Because when you search for comparable companies doing what Pharmex actually does, full-service pharmaceutical distribution with institutional sales, inventory risk, and marketing activities, those companies earn significantly higher margins, not 5%. Or eventually, considering the OECD guidelines and Mexican legislation, Pharmex could be forced to employ a profit split analysis, which would substantially increase the tax base of Pharmex, considering the actual functions it performs in Mexico. Let's assume that Pharmex's total yearly revenue is 800 million Mexican pesos. The current LRD margin at 5% equals 40 million in taxable income. The adjusted margin at 15% equals 120 million in taxable income, equals the gap 80 million pesos times 30% tax equals 24 billion pesos in additional taxes, plus the numerous penalties under the fiscal code. Total exposure, 40 to 50 million pesos or more. In this example, if the transfer pricing analysis categorizes Pharmex as an LRD, but the real operations include marketing expenses, negotiating prices to position brands in the local market to win market share, and bears inventory risk, then you don't have a transfer pricing position, you have an audit waiting to happen. The solution isn't to defend the indefensible. If the current model is outdated, fix it before the tax authorities fix it for you. Because the cost of a proactive solution is a fraction of the cost of fighting it in an audit.
At QCG Transfer Pricing, we don't just prepare compliance documentation. We help pharmaceutical companies design sustainable transfer pricing models that align contractual structure, functional reality, and arm's length outcomes. If your business model has evolved, but your transfer pricing hasn't, let's talk. Reach out to us today and schedule your no-commitment consultation.